Well, many families have children who have autism or are in the process of being diagnosed. There may be many questions, and Kyle Meades is here to tell us about a special success story about one child in particular. And we are talking about Jackson today, Kyle, is that right?
That's right, Jackson. He's one of our little guys. He's been coming to us for years. He's just a great kid. We love having Jack. There he is. I love seeing Jackson.
Oh, well, we were talking about him a little bit on commercial break, and he just sounds like such a special kid. And he's actually celebrating a birthday this week, is that right?
Yeah, happy birthday, Jackson. Jackson's going to be 5 years old this Friday,
Wow.
So I wanted to make sure we tell Jackson
That's
happy birthday.
Pretty special shout out on live TV. That's great.
Happy birthday, Jackson.
Happy birthday, Jackson. So tell us about Jackson. Tell us about a little bit about his story and how you came to meet him.
You know, I first met Jackson when he was 16 months of age. His mom and dad, his name is Chris, mom is Jennifer, they just knew something wasn't right. He wasn't communicating effectively. Again, he was 6 months of age. He should be saying single words. He wasn't. His eye contact was off. He wasn't communicating with other kids. He wasn't really playing appropriately with other children. So his pediatrician recommended that he get a speech and language eval. So when we got Jackson into the clinic, you know, we found that yes, he did have a communication problem, but not only that, we identified some other problems that warranted a referral to a developmental pediatrician, and then that developmental pediatrician diagnosed Jackson with autism.
Wow.
So we kind of picked up on that.
So that's something that's so great about your company is that these are trained therapists. They know what to look for. It's not just about helping, you know, the symptoms, as you may call them, but it's about kind of guiding them in the right direction if you do see like those signs and symptoms. So I know you kind of ran down some of the ones that we look for maybe in autism, but I know that there's so many other things that you guys do at the therapy group of Tucson. So let's really kind of run down maybe if a parent is watching right now and they think it's been on their mind that maybe their child might need some help in that regard. Kind of run down some of the things that parents might notice.
You know, one of the hallmark characteristics, not just of autism, but the main thing that we see is, you know, my child, we have a 2-year-old or we have a 3-year-old child, they're just not communicating. My kid's not, he has limited words, he's not playing well with others, he's not exhibiting appropriate eye contact, he's not requesting. A big one is, you know, my child's a pointer and a grunter, you know, pointing to the fridge instead of using their words. So that's when you want to get to your pediatrician and get the referral sent to our clinic so we can get one of our speech pathologists to do the evaluation. And then we can do a series of assessments, language assessments, speech assessments. We also look at voice characteristics, fluency, like stuttering. We look at all that, play skills, and then we're able to determine, you know, if there is a need to go to maybe a developmental pediatrician, or if we do see signs or symptoms of autism, you know, we'll make that referral. So, and once we get that referral, you know, let's just say that the child does have autism, we can show you how to navigate this huge system. We can show you how to get the therapy for your child, because there's a lot of things that parents just don't know, and that's what we do all day. So.
And how comforting it is to have somebody knowledgeable, trained, that is there to help you kind of along the way. It's super important for parents. Now, let's really break it down. For anybody watching who doesn't really understand what autism is, explain exactly what that diagnosis means.
You know, autism, you know, I've been a speech pathologist for 24 years this December, and when I first started in the profession, you know, we saw maybe a handful of cases. Now it just seems like it's a big diagnosis now. But one of the things that we look for, again, it's social interaction, it's a communication disorder, and it's a severe, it can be very mild or it can be very debilitating. So there's different degrees of autism. So, you know, it just really depends on what we see and what we find out in that evaluation.
So if a parent watching right now and is thinking this might actually be a really great step for them, how do they get in touch with you? What's the first step to coming to you?
Normally making an appointment with the pediatrician's office, and that pediatrician will know how to send that referral to our office, because again, doctors are trained in this. This is what they do every day. The pediatricians know, and a lot of times they'll send that child right on over to our office. You know, we also get self-referrals, people who just give us a call and they have specific insurances. We take most insurance plans. plan so we can get those kids worked in immediately.
Great, I know that's super important. And again, with the little time we have left, Kyle, I do want to hit on that you do so much more than speech therapy and fixing a stutter and lisps and things like that. What else do you do there?
Right, yeah, not only communication, but we also offer occupational therapy services too. And occupational therapy is another discipline like speech therapy. You know, occupational therapy works with fine motor skills, sensory problems, sensory processing disorder. And a lot of children with autism have not only the need for speech therapy services, but also occupational therapy services as well.
Wow. Well, Kyle, I think this is great. This is a really great conversation today. I know it's not the first thing you think of is we're going to talk about autism when your group comes on, but now it makes more sense. And I think, you know, a lot of people will be helped by listening to this today. So
well, I hope
thank
so.
you. Thank you for coming
thank you
on
for having
and thank
me.
you for the great work you're doing.
Thank you.
Really appreciate it. Now, if you suspect your child may be in need of a speech and language evaluation, please call Therapy Group of Tucson at 232-2021 or log on to supportvoice.com.